Chapter 35, The Ill Child in the Hospital and Other Care Settings. There are many factors that can affect a child's reaction to hospitalization. These include age, cognitive development, preparation, coping skills, and culture. Hospitalization can create a number of fears which basically fall into 5 categories. The categories are bodily injury and pain, separation from the parent, fear of the unknown, uncertainty of limits and expected behaviors, and loss of control or autonomy. As nurses, we must educate parents on expected outcomes and support them. Infants and toddlers' greatest stressor is separation anxiety. This is especially true for children from 6 months to 30 months. We must educate parents this is a normal response for this age. The things we can do is encourage parents to stay with the child. We know that it's not always possible, and we support them in their decision. Some children may show signs of regression during hospitalization, but inform the parents this should be just temporary. The infant and toddlers may also have a fear of injury or pain depending upon age and previous experience. They may also have a loss of control issues. Erickson's stage for the toddler is autonomy, and during hospitalization, they may be hard for the toddler to maintain. Allowing them to do things on their own can help with this when it is applicable. The preschooler can also experience separation anxiety, but often less than the infant and toddler. The preschoolers fear mutilation and have great fear in this area. Procedures that are painful should be performed in the treatment room. They also take terms literally, so be careful on your wording. Telling them a shot is a little poke can be interpreted that someone will keep poking them. They can have a loss of control, but they expect to stay independent. As nurses, we need to remember that and allow them to be as independent when appropriate. Provide them with choices when applicable. They have magical thinking and may feel their illness or injury is related to something they thought or did. This can lead to guilt or shame. Use of play through puppets or dolls can help the child act out their feelings. The school-age child does better with separation, but still may prefer to have a parent there. The older children may have been more worried about being separated from school and other activities. They have fear of body disability and death. Most want to know what you are doing and why, so take time to explain in terms that they can understand. They can feel loss of control at this age. Not being able to attend school or activities can be a big stressor for them. Assessing and assisting with coping techniques is necessary. Allowing them to be involved in their care and empowering them can be beneficial. The adolescent does well with separation anxiety, but some are still unsure if they want their parents to stay. They feel they should be able to be there alone, but yet they want the comfort of the parents as well. A bigger source of their fear at this age is separation from their peers. Peer relationships at this age can be more important to them than the parental relationship. Fear and injury can affect them if there are concerns regarding body image disturbances. They may feel loss of control as well. Once again, fostering their independence and empowering them to be included in their care can help with these feelings. How the child will react can be dependent on many factors. One of the biggest factors is the age and the cognitive development. Box 35.2 lists developmental approaches to the hospitalized child for different ages. Please review this. Following these guidelines can make a difference in how a child reacts to you and cooperates with the treatment plan. How you plan your care for a toddler compared to an adolescent is going to be totally different. Understanding their development is crucial. Another big factor is how the parents react. This is a stressful time for them as well, and if they're having a hard time coping, it's going to be hard for the child to cope no matter what the age. We had a parent once that was just crying all the time and not coping well due to the stress. It's very hard for that child to want to cooperate when they see the parents in this condition. It raises the child's stress level and can cause anxiety for them. Preparing the child can also have an influence on their response. Now, if there's an acute injury or illness, we can't always prepare them, but we can prepare for various procedures as well. When we talk about each individual age group later in the semester, we'll go through specifically how far in advance you should prepare the child for procedures and the best way to do this. At this point, just realize that preparing ahead of time is, in most cases, is going to help them with their anxiety and their stress. We must assess and assist with coping techniques. These will be based on age and cognitive level as well. Using distractors like bubbles or singing can help at some ages. Using imagery for older children can be helpful as well. Asking what coping techniques the family has used in the past is needed to help determine the plan of care. Play can help us determine how a child is coping with their illness. It can help decrease the negative process of hospitalization. Some facilities offer a playroom for the children to go and play. This environment should be a safe place and no treatment should be performed in this area. Therapeutic play is where someone from the healthcare team guides the play session to meet the physical and psychological needs of the child. Interpreting the child's behavior during play often requires a licensed play therapist. This can show behaviors that led to hospitalizations, coping measures, or stressors. Teaching through play is a great way to do pre-op teaching. Also can be used for simple things like taking a blood pressure. Use of hospital equipment is beneficial when appropriate. Being sure the play is age and cognitive appropriate is crucial. Play can help with cooperation from children as well. Having time for unstructured play is important for a child as well. This allows them to do whatever activity they want to, provides a sense of control. We will evaluate play as well as to see if it is being effective. If you are using play for education sessions, you need to evaluate that it was effective. A child being admitted to the hospital can often be very stressful, so the admission process is an important part and often will dictate how the hospital stay is perceived. We need to remember that we are providing family-centered care and how this hospitalization can affect everyone. We need to tend to immediate care for that child and concerns of the parents before that history taking needs to take place. We want to build a trusting relationship with the patient and family. Once the immediate needs are met, the history and physical exam is performed. As nurses, we must address the parent's concern. The child's age and cognitive age will determine how much the child is included in the process. If a child is able to answer questions, then include them in the process. The facility will include the questions that need to be completed as far as a history. The physical exam is an important part of the admission process. Many times with the pediatric population, you forego the head-to-toe approach and begin with that focused assessment. This is the biggest area of concern. For example, if they're being admitted for pneumonia, you'll want to start with that respiratory system. Many times the child may not be cooperative, so doing the focus assessment allows you to get the most important information while the child may still be cooperative. Remember to build a rapport with that child first. Explain what you are doing if age appropriate and include the child. A good baseline database is needed to determine improvements in their condition. Providing family-centered care means we need to assess how that parents and siblings are reacting to the situation as well. This can cause stress on all involved parties. Sometimes the parents are able to stay with the ill child. We often want to judge and wonder why they cannot stay with them. We do not know what is happening, so we must not judge. In most cases, the parents want to stay, but maybe they do not have anyone to stay with other children at their home. You can't assume they have someone else who can stay with the children at home. Maybe they cannot miss more work or they will lose their job. They know the child will be taken care of in the hospital, so that can make it easier on the parents. The hospitalization can cause a situational crisis for the parents, whether they can stay or not. They did not plan for this and may feel they are not in control. Like I said before, the parents' ability to cope effectively can play a significant part in how the child copes as well. Allow the parents and the child to voice their concerns. Many times the parents can have feelings of guilt for the illness. They ask themselves if they could have done something sooner to avoid this. They can feel responsible for it. Be sure to address both parents' feelings and help them with coping. Siblings can have a hard time as well. They can have a feeling of being scared and fear of the unknown depending upon their age. See Box 35.3 regarding caring for the siblings of an ill or hospitalized child. Sometimes if the child has a chronic illness and hospitalized frequently, the siblings can become jealous that the parents spend so much time with the ill child and that they may have to miss out on things as well.